Hi, my name is Shehnaz Munshi. I'm a Senior Atlantic Fellow for Health Equity in South Africa. I am a health systems and policy researcher and project manager at the School of Public Health at the University of Witwatersrand in Johannesburg. I am also a member of the steering committee of the People's Health Movement, which is a global network of grassroots health activists, civil society organizations, and academics who are committed to advocating for affordable, accessible, and equitable health for all. As the COVID-19 pandemic makes its way across our country, health activists are deeply concerned about our healthcare workers who form part of the South African government strategy to increase testing and tracing in our communities. In particular, we are concerned about community health workers who spend their day serving vulnerable and underserved communities. I would like to invite you to a webinar where community health workers from across the country share their experiences and reflect on the question, who is caring for the carers? Most of the community health workers in the webinar are activists and members of the People's Health Movement. What struck me most about the conversation is that COVID-19 has amplified previously existing fault lines in the health system, placing community health workers in an even more vulnerable position than they have been previously. While the world is only beginning to grapple with the need for personal protective equipment, for example, community health workers in South Africa have a history of asking for PPE and adequate protection for the many numerous risks that they face. This includes the risk of contracting tuberculosis, gender-based violence, and criminal elements. Community health workers are clear. COVID-19 is a health problem, a mental health problem, and a social problem, and they have an important role to play. As a group of largely Black women from vulnerable communities, it is clear that community health workers don't live single-issue lives. They have to overcome multiple intersecting gender, race, and class oppressions as these women bear the burden of a failing public health system, hunger, education, social services, and rising unemployment. They see this moment as an opportunity for the South African government to strengthen the structures that support them in the work that they do of being the eyes and the ears of the communities they serve. As a start, they want recognition, appropriate protection, and to receive a graded salary reflective of the work that they do. They want to be integrated into the health system and embedded in the communities they serve. To hear more, please join us by visiting the STAR YouTube page and the Tekano YouTube page to watch the webinar. Thank you.